In this final section, we will discuss the importance of monitoring the success of oxygen therapy in the patient. Several vital signs can and should be monitored during oxygen therapy. These include, but are not limited to, mucous membrane color, respiratory rate and effort, arterial blood gas, and pulse oximetry. Let's briefly discuss these techniques and their uses. We will begin with the mucous membrane color. To evaluate the mucous membrane color, observe the inner lip and gingiva, the conjunctiva of the eye, the penis, or vulvar mucosa. Animals that are hypoxemic or have a low oxygen level will have pale, pink, gray, or blue mucous membranes. The desirable color of these membranes is pink. This suggests optimal perfusion of blood and tissue oxygenation. Animals that become anemic or animals that have acetaminophen toxicity can develop a pale or gray mucous membrane color. Next, we evaluate a patient's respiratory rate and effort. To evaluate the respiratory rate and effort, count the breaths per minute and observe the amount of work needed for the animal to breathe. In the normal resting animal, the respiratory rate should fall between 6 and 12 breaths per minute, and there should be little effort required for inhalation and exhalation. If the respiratory rate falls above or below these normal levels, the attending veterinarian should be notified. Keep in mind that pain as well as restrictive dressings around the chest cavity can increase respiratory rate and effort. Pulse oximetry is a very simple and effective means of measuring the patient's blood oxygen level. To evaluate blood oxygen level, place a pulse oximeter probe on the patient's lip, pad, rectum, or femoral artery. The probe will likely need to be positioned for acceptable results. When using a pulse oximeter, be sure to take a palpable pulse rate. If the pulse rate on the oximeter does not match the palpable pulse rate, the reading may be false. Low body temperatures and dark pigmentation can also falsely produce low readings. A patient's arterial blood gas can also be evaluated for oxygen levels. Only perform this procedure if you are proficient with arterial blood collection. This program will not attempt to instruct you on the technique for collecting these samples. If a sample falls significantly below normal values, it should be compared to a venous sample to make sure the arterial collection was not inadvertently mixed with venous blood. All of these monitoring methods will provide the veterinary team with valuable information on the critically ill patient. If at any point a patient exhibits weak vitals or oxygen levels during supplemental oxygen treatment, alert the attending veterinarian.